Hello, welcome again to class. Thank you so much for staying tuned. Thank you so much for liking and subscribing, following. And you see it that we're doing something good, you want to tell someone else. Why don't you share with those in your group, your circle of influence? Thank you so much. Now let's go on. We have today in our series of study of ailments or diseases that affect poultry. Now we have fowl cholera. Previously we talked about fowl pox. We looked also at Newcastle disease, viral disease, fowl pox viral, Gumboro disease viral, causing and also Marex, and also avian encephalomyelitis and the others. You want to go back to those videos, please check on them so you learn more on the things we covered. Now today we go into fowl cholera. Now what is the name fowl cholera? What are other names? Other names: avian hemorrhagic septicemia. Now let's break it down quickly. Now when you see the word avian, it's referring to aves. That is the group in which chicken belong to, feathered birds, feathered animals. Hemorrhage. Now what is hemorrhage? Hemorrhage means bleeding. Hemorrhagic, that is a kind of a word that qualifies a situation where the blood vessel bursts or there is a rupture in the rupture means bursting or tearing off, rupture of the blood vessel. Septicemia means like what is a poisoning of the blood. Now what causes the poisoning of the blood? The bacteria. Now bacteria, now in other words, this fowl cholera is actually a bacterial disease. Unlike the previous I've mentioned, Newcastle, Gumboro disease, which is infectious bursal disease, and also there's also the infectious bronchitis, which we looked at previously. This one, unlike, is a bacterial disease. So the bacteria infects and there's a rupture in the blood vessel. Now this leads to something about the signs and symptoms. Once again, fowl cholera. It's also called avian, has to do with birds. Hemorrhagic, referring to bleeding that comes as a result of rupture or bursting of the blood vessel. The vessels that carry blood. Septicemia means the poison of the blood. Another thing is pasteurellosis, which means is in reference to the causal agent. What are the causal agents? Pasteurella multocida. Pasteurella multocida. That's the bacteria that causes avian fowl cholera. Now this name is in reference to the cause of it. Now what is it about fowl cholera? Fowl cholera is actually a non-respiratory bacterial disease of chicken. Now what that tells you, when we say non, a good number of diseases in poultry that is caused by bacteria affect the upper or lower or both respiratory system of the birds. But this one has nothing to do or not much to do with the respiratory system. Not much to do with it. Now what are the signs and symptoms? You may have noticed I've started with death first. Sudden death happens with fowl cholera. Now that does not make it in any way worse than others that was looked at before. We talked about very deadly ones like Newcastle disease and Marex and the others. But that cannot be treated or can be managed. Now but these, you just come to the farm, healthy birds, the next day you come a few hours, suddenly death, it happens. When there's a rupture in the blood vessel, it can happen. Blood rupture, boom, and before the death happens after a short time. Other signs that you see is loss of appetite and reduced feed intake. Usually a bacterial infection, when the bacterial population have increased after proliferation, you see loss of appetite because also they will be feeding on the blood cells. Loss of appetite, which also means less feed intake. And like I've said before, if you've been watching previous videos, when we talk about loss of appetite, is always related to what? Weight. It's going to affect weight gain. That means the weight, there's loss. There's loss of weight. The same thing applies to humans. You're not feeding, you're not going to add weight. Now the next is ruffled feather. Ruffled feather, we've come across this before. with we've seen that with gumboro disease. So it's also one of the things you see with this. Now the reason why we give up to 5 or 6 or even more is that some ailments have or share the same characteristics or signs and symptoms with others. So by the time you're able to compare this, you discover that the signs and symptoms for this are about the same with this. Just 1 or 2 or 3 of them down the line, you discover that, oh, because of this and this and this, or this and this, we can tell that this particular ailment is the actual cause, not this one. So you also see ruffle feather. We talked about that also, which is one of the signs you see with gumboro disease. Then we also see number 4, difficulty breathing, belabored breathing. We've seen that with Newcastle disease. We've seen that also with Marek's disease, especially when it affects the muscles of the lungs. But this time, this one having sharing this characteristic with Newcastle disease and Marek's disease, but it's different. This one shares with gumboro disease. Now fever. Now this is where you get the name having to do with a feverish condition. Now you also see a mucous discharge from the mouth, a mucous discharge, and then there's a joint infection. The joint infection causes lameness. The birds are unable to walk. Now, but that's not to mean paralysis, as you will have it with Marek's. Then number 9 is swollen foot and pad. Swollen foot pad. You know the foot, the under part of the cheek. You see swollen, so they are not able to walk. This also happens with the joints that are swollen. Then number 9, you have rattling noise when breathing. Now, difficulty in breathing linked with this. Difficulty in breathing, they can't breathe well freely, effortlessly. But then, almost belabored, and you keep on hearing some rattling sound, you know that the bird have noticed. So when you look at all these things, you'll be able to tell with all these features, all these signs and symptoms, it points to fowl cholera. Then the next is abscessed wattle. The wattle is distended. You see pus collection in the wattle. That's another sign you're dealing with fowl cholera. And then discharge of exudates. Exudate means something like, let's say pus coming out, or some liquid or fluid that forces itself out through an opening. They've been there collected, but whenever they find an opening, whether there's a rupture, you see comes out. Just like you have with trees, you take your knife, you just cut some part of the tree. After a while, you just see some liquid fluid. They call them exudates. Now you can find exudates coming out from the eyes of infected birds with fowl cholera. Now, before we go ahead, I just want to tell you that if you've not signed up for this, you've not subscribed or followed, we've been learning a great deal. And after this series of lectures on fowl disease, will be going on those on nutrition. So please follow us, like, subscribe, and tell others that you're getting value here. Now let's, before we draw the curtain, go to the mode of transfer or mode of transmission. How does it move from one bird to another? And then, if not taken care of or managed properly, it goes to an entire flock. How? Contact with wild bird or stream birds. Now, some people see someone else's bird going astray, and then you say, oh well, this is good, let me add this to my flock. No, not good enough. It's not good. Now, when you have another bird coming into yours, please take that bird off. Don't let them come in. Don't also allow stray birds flying here and there. One of the reasons that some of them go to dump sites and they pick other things, they come and meet the midst of a flock, especially if your flock are on free range. No, don't allow. And that one is almost similar to it. It's addition, deliberate addition to the flock. You've gone somewhere and someone says, oh well, I've seen this, or maybe someone else in crisis. You buy the flock, you buy the birds. Don't bring them directly into your flock. Or maybe you just want to increase the number, you go to the market or wherever, you buy from another farm. Don't introduce directly. I've said this in previous videos, especially the last one, that before you add anything to your flock, keep them in a separate pen or some pens for 2 weeks minimum to see if they have some pathogens in them that can develop into an ailment. So within that 2 weeks, you'll be able to manifest. If they do not manifest within 2 weeks, maybe go to 3 weeks, you're sure that these ones are comparatively healthy, and then you introduce them to your flock. That is what is called quarantining. Quarantining, you set some birds away, out from the others. Another thing is infected equipment or clothes by now another mode of transfer. Sometimes the pathogen, this Pasteurella multocida, can be on equipment you use. Like those people, like I talked about this, please be careful when you have your farm hands, those people are working for you, especially if you have a farm in a farm settlement where you have other farmers doing the same poultry. Please watch and warn those working for you. Don't keep going to other people's farm and then coming back. So, oh, we don't have this, so let's borrow from the other farm. You borrow from the other farm and you also pick free disease. You borrowed something, you picked free pathogens, and you brought it to your farm. So you have to be careful of equipment to borrow, and also it could come in through clothes, it could come in through the environment. Some places become endemic of certain ailments. Then number 4 is vectors. What are vectors? Vectors are organisms that carry pathogens. They may not themselves fall ill of the pathogen they are carrying and distributing, but they have them. So it could be cockroaches, it could be insects, it could be rodents, it could be birds, it could even be persons. Some people are themselves vectors. And so we have it today. Fowl cholera, we talked about all these things. Now you want to stay tuned in the next class to see what happens when it happens in the farm. How do you treat them? And now, what do you do to prevent them? We'll see in the next class. Thank you.